Come back here. Hello, it's Dr. Pat with Little Critters, and we have Sage here today. And Sage is a 5-month-old female hamster. And we're doing a video with her because this is a fairly common problem, and if you have hamsters, you should be aware of it. You can see she's very active and busy right now, but there is a very common problem we see in female hamsters. Do you know what it is? Have you had this problem in your hamster? So female hamsters can get a condition called pyometra. And pyometra is a uterus infection where they get typically an E. coli infection in the uterus, and it causes pus to build up. And that pus can actually be a closed pile where it all stays in the abdomen, or an open pile where it's draining out. And this can be a life-threatening problem for hamsters. I don't mean to laugh at that, she's just very busy right now. So pyometra is very serious in hamsters. It is life-threatening. If it's a closed pile and that pus isn't draining, it's a critical emergency. It occurs in dogs and cats as well, but it is fairly common in female hamsters, so it's something you should be aware of. Sage presented today because she was very lethargic. She's obviously feeling a little bit better now, but if you look at her bottom, she has pus that's intermittently just draining out of her bottom. She doesn't have diarrhea. And there's also a very strong odor associated with this. And the problem with this is it is a hollow organ or tube inside, and we deliver our antibiotics through blood vessels, and they don't go inside the uterus. And so while antibiotics can provide somewhat palliative care and kind of suppress this for a little bit, it doesn't cure or remove the infection. And so it's very important when we have a pyometra or an infected uterus that we actually spay them. And yes, you can spay hamsters and rats, and just like you do dogs and cats, but if it is truly a pyometra, it is important to get them spayed and remove the reproductive organ that's causing the problem. Because again, this is life-threatening. Antibiotics will often temporarily improve the situation, but when we stop the medication, it does come back. So that's the plan for Sage. So we've recommended some imaging to take a look at the uterus. We're doing some cytology to see if there's white blood cells and bacteria here, which is what we expect. And then the plan would be to get her spayed. She likes the wheel.
She's very cute.
She